Hello, everyone. It's a pleasure to meet you, and thank you very much for having me. I'm not going to share any slides today as I tell my story because it's important that you hear the words I say next. My name is Eve McDavid. I'm a tech executive, a media expert, and a journalist. I'm a mom of 2 young children, a wife of 9 years, and a young woman of 36 years old. Simply put, I am a woman with a life and a future worth protecting. I am also a 3-year survivor of a stage 2B cervical cancer diagnosis that occurred while I was 35 weeks pregnant, living in New York City, just weeks before the start of the global COVID-19 pandemic. I'm telling you my story for the purposes of education, for normalizing this field of sexual and public health, and ultimately to spark change. I had an extraordinary journey that's lasted 3 years, but it unfolded in spurts. 3 days from discovery, diagnosis, and to the delivery of our beautiful son. 3 months from the start of treatment to completion and the beginning of a new life in the middle of the pandemic as a changed woman after gynecologic cancer treatment, looking for hope in the very difficult experience I had just endured. At the time of my diagnosis, I was an executive at Google, and I'd been at the company for almost a decade. I'd worked across most of private industry and the public sector. And so I came into this field of cervical healthcare and cervical cancer, both as a patient and as that executive. Through my time in tech, I built a track record of using technology as a solution for complex problem solving. And what I saw in this field was astounding. I had the privilege, because of my caste and because of my healthcare insurance, to access the best care in the world and have the opportunity to select my treating team, the most visionary, compassionate, empathetic oncologists who are also moms and women of color. They treated my case in such a way that produced my extraordinary outcome. And they kept treating through the pandemic when other doctors made impossible decisions to delay care with life-altering consequences. My outcome required miracle after miracle after miracle to occur as it did. And so for me, this is where the storyline falls apart. Why must it take such extreme interventions to save a woman in her prime from preventable cancer? Cervical cancer can be prevented with the HPV vaccine. It can be prevented with access to screening via PAP and HPV testing. It can be caught early, treated and managed successfully, and even cured early. But still, there are at least 14,000 domestic diagnoses each year, and that number is more than 600,000 worldwide. Most devastatingly, these diagnoses disproportionately impact low-income communities and communities of color due to the lack of awareness, the sexual health stigma that creates its own barriers, and inequitable access to care, to quality care. Worse is that we know these numbers don't account for women with precancerous lesions and high-risk HPV infections, unsure of what to do next in their course of treatment, and trying to navigate the system without a common language, with no playbook. And then I think of the clinicians and the healthcare providers in the field who must also be public health experts and vaccine advocates and thought leaders in their own professional circles. These visionaries must use tools and technologies from another era, screening technology from the 1950s, brachytherapy treatment tools from the 1970s. This is what the state of care for preventable cancer looks like in the best hospitals in the world. It only degrades from here. But I also have so much hope for where the industry is today, our starting point, because we do have solutions. Recent data shows the promise of the HPV vaccine, with cases dropping precipitously among persons 20 to 24, who are among the first generation of children to receive it. That early stage cancers have survival rates above 90% for women able to access care, and that patients like me who access brachytherapy can be cured. This gives me tremendous optimism for what's possible when we work together as an industry to gather and to focus, formalize, and fund this critical industry at the intersection of oncology and public health. So, where can we go from here? That is to be the mission of this American Cancer Society National Roundtable on Cervical Cancer. And from my experience in organizing and advancing industry, here's what I would do. I would start with the problem statement that we have solutions to prevent, treat, and cure cervical cancer. And yet, women are still dying every single day from this disease around the world. My framework is to understand the people, the processes, and the products that underpin this problem statement, identifying the bright spots and the pitfalls, the gaps, and the opportunities. So, let's start with the most important part, the person. The person with a cervix from every walk of life across this planet needs to be at the center of the equation. What does their life look like from beginning to end, and what are their needs? What are their risk factors? And what are the expected outcomes when they may have been exposed to a high-risk HPV infection? And so we can answer most critically, when, how, and for what do they intersect with their local healthcare system? With this understanding mapped out, we can get into the second touch point, the processes. We can identify where today's solutions work, how to get them to the people who need them most, and where these solutions just aren't options. So that leads us to the third part of the framework, the products. And this is where we need the most innovation. I learned in a summit last week hosted by the Moores Cancer Center at the University of California, San Diego, that the standard of care in cervical cancer treatment hasn't changed in 25 years. 25 years. How is this possible? Our work as the Roundtable is to lead and create this change, to advance the field, and to have it reflect the best of modern technology and modern medicine together. New options like point-of-care screen and treat tools and HPV self-sampling at home hold great promise. So does modernizing treatment equipment to be better suited for each woman's anatomy, like the work I'm co-leading at our company, Mission Driven Tech. This is just the beginning of what's possible when we bring innovative, passionate, and committed experts together to advance the field. The work of this roundtable is to embody the intersection of oncology, public health, education, the private sector, the public sector, sexual health and wellness, and their touch points across community systems. Eliminating cervical cancer is possible, and it will require all of us to work collaboratively with a shared mission, vision, objectives, and goals. It will require awareness, investment, and a bias towards action. It will be hard to rewind the vaccine misinformation and shatter the stigma that shrouds sexual health. It will take time, blood, sweat, and tears, but it will save the lives of millions of women and families in the process, and that impact starts now. This is why we're all here. We've come together to shape and define this industry, to demonstrate what's possible when everyone works together on what I view as the most important public health crisis of our lifetimes since polio. This work to protect our children today is the difference from them living their lives uninterrupted by preventable cancer, meaning that in their prime, in their 30s and 40s and 50s, they don't disappear from their families and communities, creating shockwaves of pain, grief, despair, and devastation. These human systems to which they were connected irreversibly changed, and usually for the worse. Ending cervical cancer is achievable. It's as simple as that. I look forward to getting to know each and every one of you and the efforts of this collective team and being part of our hard and important work ahead. I know we can do this because we have to do this. Thank you all so very much for your time and attention today.